Good afternoon. My name is Shamar McFarland, and today I'm here to talk to you about Doc Talk, the place to talk about the docs. So first, I'm going to go over my personal story, what initially got me into Doc Talk in the first place. My mom was diagnosed with breast cancer and was given a list of cancer treatment facilities in Florida. She did call a few and went with the ones that she liked best out of those places that she did call, but she didn't go through most of the list because it was an extensively long and exhausting process as well as an exhausting list. So what if there was a better doctor farther down the list that she could have gone to? So recently, Roe v. Wade was overruled, and states can now create their own laws and regulations regarding abortion, which has created many problems for patients trying to find doctors legally able to do the abortion procedure. For example, there was a 10-year-old girl in Ohio, and trigger warning for those of you affected. There was a 10-year-old girl in Ohio who was a victim of rape, and she was unable to receive the abortion procedure because of the new regulations that were put in place in Ohio. She was 3 days over that limit. So she had to be sent out of Ohio and to Indianapolis so that she can get the procedure done. So as for the customers we're targeting anybody who's affected by medical ailments, but more specifically, we are targeting younger women of African American descent um, younger women of African American descent or those affected by a lower income bracket. According to the BBC, those are the group of people that are most affected by abortions or lack thereof. So the alternatives that there are to searching for your doctors are doing independent research by just Googling a list of different people. For example, you just type in cancer treatment facilities if you're looking for one of those at the time, and then you get 13 billion different search results for that. The second alternative for that would be using the referrals provided by the doctor. And as you can see from this extensive list here, there are quite a few doctors on that list. None of them that your doctor at the time would have your specific situation in mind. They're just giving you a list of people for you to check. So it's kind of like the Googling, but a little bit narrowed down. So my solution for this is DocTalk. It's an interactive app that allows future patients to search for the doctors and medical institutions that are right for them. So they would be using their specific search criteria, like their insurance, what kind of insurance provider they may have, financially, like the range, the price range that they were looking for to pay for a one-time procedure, or if it's going to be multiple treatments, they'd be able to look that up as well. They would be able to go off of reviews from past patients that have used the app for the doctors or the medical facilities. They would be able to leave the reviews as well as their rating for those places and those people. So after you input all of your search criteria into the app, then you'll get a small list of results from around 1 to 10 results based off of your specific information. The more specific, the smaller the list. After you've selected 1 or 2 or however many of those selections that you have selected, then you'll be able to get travel information, because some of these places may or may not be out of state or out of an area that you're comfortable driving in, or a place that you haven't been before. So it would be able to give you travel information in that 4th tab there. So my overall value proposition for DocTalk is that the issue of being unable to efficiently find a doctor regarding specific financial and medical information is one that doesn't plague a whole lot of people, but it is extremely inconvenient for those that it does. DocTalk eases that stress of having to coordinate their insurance, the referrals, as well as the finances from the patient that is already trying to come to terms with their new medical ailments. This concludes my presentation. If there are any points that require further clarification, I can address those now. If not, thank you for your time.